Good morning. I am Dr. Rita Kadamian. I am a nurse practitioner and I work for Children's Hospital of Wisconsin. I have been in my role as the medical provider at the Child Advocacy Center for the past 14 years since its inception. And first of all, I have to say that it's going to be really tough to follow. So thank you, Felicia. That was beautiful. But today I am here, first of all, just to talk about the Child Advocacy Center. So many of you may wonder, what is a Child Advocacy Center? Or a CAC, as you may have heard Lisa and Felicia refer to it. So today my goal is to just provide a virtual tour of our CAC here in Kenosha. A CAC is a child-friendly and neutral location where children may have a forensic interview or a medical exam when there are concerns of physical abuse, sexual abuse, neglect, or even witness to violence. The Child Advocacy Center model's main objective is to reduce trauma to child victims by bringing all the disciplines together and sharing information to be more efficient and to minimize duplication for the children. The multidisciplinary team that participates in this process, Lisa and Felicia have both referred to it, but it includes a forensic interviewer, medical provider, law enforcement personnel, child protective services, prosecution, mental health, as well as victim advocacy. So prior to the CAC model, like I said, we've been in Kenosha for 14 years. And this has been, we're kind of on the cutting edge in Kenosha. This is something that was developed in the 80s and has been, crossing the country nationwide. In Kenosha, we were the 4th Child Advocacy Center in the state, and there's now, I think, 16. So prior to the CAC coming, there were concerns of abuse. Maybe it's a child who was at school and disclosed to their teacher. So after the teacher hears this, the first thing they do is send the kid to the counselor. So the child goes to the counselor, tells their story again. The counselor says, oh, yeah, we'll send you to the school nurse. You tell the school nurse about it, and she's probably going to want to look you over and probably do an exam that she's not prepared for. Next, the school nurse is going to send them to the principal because, the administration has to know and, be willing to deal with some of this. So as the child's telling their story to the principal, hopefully somebody has called social services. So the child protective service worker comes to the school to talk to the child. They call law enforcement, and law enforcement sends a patrol officer. The patrol officer realizes this is in the detective realm, so now we have the child telling the story to a detective. At this point, we better get that child to the hospital, and we all have been in a hospital and we know how that goes. You tell the person at the desk, and then you tell the nurse, and then you tell 3 other people that come in the room before the doctor comes in, and you tell the doctor your story. Well, under these circumstances, we better get a hospital social worker involved too. So now this child needs to tell their story again. If charges, are forthcoming later on, now this child has to talk to a number of people at the district attorney's office. And you can see that this poor child has probably had to tell their story 10 or 15 times. And that can be very traumatic. So the goal of the CAC is to really minimize this trauma and minimize how many times children need to tell their story. So now CPS workers, like Lisa talked about, work jointly. They go out and they talk to the child together. And often they're only doing just a minimal facts type of interview so that they can bring the child later to the CAC, and the child really only has to tell their story one time. So based on the circumstances of abuse or neglect, children who are brought to the CAC may have a physical exam, a forensic interview, or they may have both. And to ensure children feel safe at the CAC, there are no potential perpetrators allowed on site at the time of the evaluation. The children who are going to have an interview must have developed adequate language skills to participate. The forensic interview at the CAC is performed by a social worker, specially trained in the area of child abuse, and specially trained in the area of child interviewing techniques. The interview room is equipped with cameras, microphones, and video recording equipment. The interview follows a specific, legally sound protocol and is conducted with consideration of the child's developmental level. The multidisciplinary team that is involved sits in a separate room and can watch the interview through a closed circuit television. This way, everyone can hear the child's story at the same time and gather the same information to coordinate their investigation. The interviewer will check in with the team prior to concluding the interview. In any case, there's additional information that's necessary or maybe they need some clarification. Again, not only one person has to talk to this child and get the whole story. The medical examination consists of a health history, as available based on the caregiver that may be present, and a head-to-toe examination with a specialty focus based on what the type of abuse is that is suspected. Special equipment may be necessary for certain types of examinations. I think these are CAC pictures that are going by now. You'll see the exam room and you'll see what we call a colposcope, which is something we use in child sexual abuse evaluations. Forensic evidence may be collected and certain specimens may be obtained for infections or other medical concerns. Other types of testing, such as labs and x-rays, are ordered at the CAC, but the children are sent to an outside facility like a hospital or radiology center for those tests to be completed. Medications are prescribed as appropriate and referrals for follow-up care and counseling may be provided during their CAC medical evaluation. Child abuse pediatrics is an area of specialty. So just as a child may go to an orthopedic doctor for a broken bone, it is essential that children who are possible victims of abuse are evaluated by child abuse experts. Children are referred to the CAC for abuse evaluations only by our core multidisciplinary team professionals. These aren't the types of evaluations that, a parent or a neighbor calls and tries to schedule. The only exception to that is medical providers. Other medical providers in the community, ER physicians, primary care providers do refer children for only the medical portion of the examination, as the interview must be part of the investigation. One final aspect of the services at the CAC I would like to highlight is the role in the medical evaluation of children who are placed in out-of-home care. Research has demonstrated that children in foster care have significant health care needs compared to the general population of children. They have more physical problems, developmental delays, mental health conditions, and significant dental issues. We also know that often these children haven't had adequate health care in their home environment, and they are very likely to have been past victims of abuse or other types of child maltreatment. So in January of 2014, a pilot program in 6 Wisconsin counties was initiated, and it's called Care for Kids. Kenosha is a participant in this program that provides enhanced medical services to children who are placed in out-of-home care. There are numerous components to the Child Care for Kids program, but the first step is an initial screening exam within 2 days at the Child Advocacy Center. At this visit, the focus is screening for potential abuse, addressing any urgent health care needs, making referrals for appropriate specialty care, and educating foster parents regarding the child's health and development and necessary treatment. But to illustrate the CAC concept a little more clearly, I'm going to provide a brief example of a typical scenario at the CAC. The children's names and a few details have been changed or omitted just to protect confidentiality. So 6-month-old Deanna and her 2 siblings, she has a 2-year-old brother Anthony and a 4-year-old brother Joseph. They had been in the care of their mother and her boyfriend that morning until they got on the bus for daycare. When the children arrived at daycare, the staff noted bruising on Deanna's face. As mandated reporters, they contacted the authorities. Now, as you can see, we have very well-trained investigators. So our law enforcement and child protective services investigators are very aware and have heard me say it many times. But any non-mobile infant with bruising is a scenario that is very concerning for abuse. And I know they won't even want me to say these words, but this is a sentinel injury. So what we refer to as a sentinel injury are minor injuries and minor trauma that may occur before the child is significantly physically abused. We know that more than 35% of children who are victims of abusive head trauma, or what we all might know as shaken baby syndrome, had evidence prior of some type of minor injury. So the investigators immediately contacted the CAC to schedule an urgent visit for these children. So Deanna and her siblings arrived at the CAC with investigators. And you might wonder, well, why did they all come? The little baby's the one with the bruising. But it's typical that when there's concern of abuse to one child in the home, that there's concern that other children in the home may also be victims of abuse. So we want to make sure we're doing a complete evaluation of all of them. So we'll start with Deanna. She had her physical exam. Remember, she's 6 months old. And there's significant bruising on her face that's patterned. And by that I mean she had bruises that were of similar shape and size, or maybe they represented that of a typical object. In addition, she had bruising on her ear. She had subconjunctival hemorrhages, those are those little red bloody spots in the whites of your eyes. And she had a small tear of her labial frenulum. And yep, that's just that little piece of tissue that connects the inside of your lip to your gums. These are all injuries in and of themselves that are concerning for abuse. During the time from the call to the authorities and completion of this child's exam, our law enforcement officer had already been out to talk to mom and her boyfriend. They could not provide any history to account for these injuries to this 6-month-old baby. Well, we certainly know that a 6-month-old can't care for themselves. So developmentally, there is no way for a 6-month-old child to acquire these injuries without a caregiver being aware of what may have happened. So this lack of history increases that concern for physical abuse. Following Deanna's checkup, she had some additional tests, x-rays and labs, that were ordered and completed at a local hospital. We wanted to make sure that there weren't additional injuries that weren't, readily available to the naked eye, as well as rule out some other medical conditions that might cause easy bruising or some of these injuries. Those tests were all negative. There was no known condition that could have explained the injuries, but fortunately, Deanna did not have any brain injury or any broken bones. So this is a scenario that in child abuse pediatrics in our medical world, we refer to as a SAVE. This was an intervention before this child was brought in, suffering injuries that would have resulted in long-term neurological consequences or even death. The lack of history related to the cause of the injuries, in combination with the physical exam findings and other medical tests, led to the medical diagnosis of inflicted trauma consistent with physical abuse. So as I mentioned, it's important for all the kids to have exams, and so that day, Deanna's brothers were also examined. I sometimes have some availability of some medical records, which I was able to review on the 2-year-old Anthony. He had had an arm fracture earlier in that year, again with no history to explain the trauma. He also had a history of a congenital health problem that required specialist care. The medical records indicated that there was not adequate follow-up. There were numerous no-show and canceled appointments, and he hadn't had the tests that had been ordered to monitor his condition. Anthony's exam on that day was essentially normal. He had a few scratches and bruises, but certainly nothing out of the realm of normal for a 2-year-old boy. But prior to leaving the CAC that day, he also had the tests necessary to address his congenital health condition scheduled and a follow-up appointment also scheduled with a specialist. Joseph, the 4-year-old, was also examined. He had a few sort of non-specific, linear kind of patterned injuries, but these were injuries that could have been the result of abuse, or again could have been the result of accidental trauma. And when asked, geez, what happened? How did you get that owie? He would say something like, oh, my brother scratched me, or I don't know, or I fell. But again, that goes back to what Lisa talked about, that sometimes they're just not really ready to talk about it. Or they've been coached at home. But Joseph was of an age that he could participate in a forensic interview at the CAC. He was brought to the interview room at the center by our forensic interviewer. She explained the process and showed him the cameras and the microphones. She told him about her helpers that were watching in another room as they talked. She first talked to him about things that he liked to do. She built some rapport. And then she talked to him about the differences between a truth and a lie and made him promise to tell the truth that day. She asked him some open-ended questions that led to narrative responses about things that happened in his home. Joseph was unable to provide any details regarding his sister's injuries that day, but he did report that he and his brother get whooped with belts and cords at home, and he described situations of domestic violence between his mother and her boyfriend. The information from the forensic interview and examinations at the Child Advocacy Center assisted Child Protective Services to determine that these children were not safe in their home. They would need to be placed in out-of-home care. So that's what happened that day with those children. And in typical cases like this, as a medical provider, I seldom find out the long-term outcome. But I do know that when they left the CAC that day, they would be safe in a foster home.